Practice managers have an important role in PRO implementation. The collection rates required for consistent clinical use and quality reporting are not possible without strong management practices to address the clinical microsystem. Clinical microsystems are comprised of the staff and workflows that provide patient care. A complete description of the clinical microsystem approach to managing PROs is available here. Let's listen to some managers describe techniques they have used to successfully implement PROs.
We send automated messages by email and text, asking patients to complete a baseline and 12-month PRO. Many patients complete the PRO by responding to these messages. We have worked with our IT department to assist us with tools to prompt patients who need extra reminders. They have designed reports to make it easier for my staff to identify who has and has not completed the PRO. This report is used by staff at the front desk to identify who is here for a visit without a completed PRO. Just like getting a weight or blood pressure, we consider the PRO to be information the clinician must have for the visit. We have also designed a report for the medical secretary in charge of sending reminders to patients to complete the 12-month PRO. This report enables the medical secretary to see who has not responded to our automated reminder, so she can send a personalized email or text, or make a phone call. We achieve the required 50% response rate during some months with our automated process only. But during months that we need to collect a few extra, we have this phone call process we can put into action.
I make sure each of my staff involved in PRO implementation is trained on their role and knows they are accountable for completing it successfully. For example, each of the medical secretaries at the front desk know they are responsible for checking to see whether each patient in the waiting room has completed the PRO before their visit. If a patient has not completed the PRO, these staff members ask patients to complete it. Since they may have to answer patient questions during this process, I make sure they know why completion of the PRO is important and can explain that to patients. I also make sure the rooming nurse queues up the PRO for the clinician during the rooming process so it is available for the clinician to use during the visit.
I pull reports from our EMR and track PRO completion rates at baseline and 12 months very closely. This way, I can adjust our workflows real-time as needed, and I share the results with our staff. If we are on track to achieve our 60% goal, we celebrate. If not, we adjust our process to enable us to meet the goal.
If you are reporting for quality, your workflow should ensure consistent collection following regulatory mandates. Keep in mind that you'll need a representative sample to accurately reflect your practice. CMS requires a 50% longitudinal collection rate, while research standards are 60%. It is ideal to collect PROs from all patients if you are using them for clinical care. Visit our website for free downloadable templates and guides to assist you in implementing PROs.